The Supreme Court's decision to overturn Roe v. Wade has serious implications for women's health.
That's right. So for more on this, we're going to bring in Dr. Celine Gounder. She's the editor-at-large for public health at Kaiser Health News. Dr. Gounder, welcome. Great to have you with us. So putting politics aside for a moment and just looking strictly at the way this ruling will affect women's health, how do you anticipate it affecting women across the U.S.?
The typical woman in the U.S. getting an abortion is poor and already has a child. 40% of children in the U.S. already are living in families that are poor enough that they qualify for Medicaid and Children's Health Insurance Program, or CHIP. And we're going to see women who are forced to carry a pregnancy to full term, who are already poor, becoming that much more entrenched in poverty. The United States has the highest rates of mortality, so death from childbirth, among developed countries in the world. And Black women are 2.5 times as likely as white women to die in childbirth. I think we're also going to see women thinking twice if they're at higher risk for complications in pregnancy. So this might include women of color, older women, by which I mean maybe in your late 30s or 40s, women who have underlying chronic medical conditions or are using fertility treatments. I think you might see them thinking twice about whether they want to carry a pregnancy when the options, if they have a complication, may be limited.
How might this ruling impact the oral contraception debate?
Well, right now, oral contraceptives will remain available. That includes emergency contraception, which is an oral contraception like Plan B. But Justice Thomas has indicated that all kinds of contraception may be on the table, which may include emergency contraception or intrauterine devices, IUDs, which are the most effective form of contraception.
And we specifically spoke about, and we were speaking with fertility doctor, how might in vitro fertilization be impacted?
Well, the issue here is, will these embryos be considered a person, have personhood? And so what will that mean if you want to defrost, thaw an embryo and implant it? What will it mean for women who are trying to maximize each cycle and get as many embryos as possible? Well, they may not be able to do that. And the risk, again, of complications is higher when you're implanting multiple embryos. And really, for any woman who's high risk, there are exceptions in these abortion bans across the country for the life of the mother. But what does that mean? How much blood do you need to lose? How infected do you need to be? Do you need to have bacteria in your bloodstream and be in an ICU for you to qualify for a procedure to help you through that?
So there's still some gray areas that are not totally clarified. But just to be clear for our viewers, the so-called day after pill, the Plan B contraceptive, all of that can still be purchased at any state in the country?
Correct. So wherever you have access to Plan B, that will not change. Emergency contraceptive access will not change, at least for the time being. But whether that will continue to be the case remains to be seen.
Interesting.
What extra precautions should women have to take now when deciding whether or not to start a family?
Well, I do think they need to think about how high risk they are for a complication. And I think women really do need to do whatever they can, if they're not ready to start a family, to get access to contraception. Unfortunately, many of the states that will be banning abortions moving forward are states that have not expanded Medicaid. So these are states where women have a harder time accessing health care, including contraception.
Right. And these are women that will have a harder time traveling very far distances if they really do need to get an abortion. Should medical professionals in states where abortion is still legal expect an influx of women seeking the procedure?
Many states are preparing for this. So states like California, Colorado, New York. I think the question remains, though, will those women be criminally or civil? Will there be civil liability there? Could physicians operating in out-of-state clinics also be criminally liable and prosecuted by states who have an abortion ban? What will this mean for telehealth? So those apps you can get on your phone and get medication abortion. What will it mean for that? We don't know.
Yeah, all these practical
we've been discussing this with our legal experts, and they didn't have clear answers either. This is all very vague as of yet. So
I know, and medical professionals, I mean, a lot of people are asking the big question. How far back will we go? How much will this reverse, like, our quality of care? Unsafe, unregulated abortions, might they reemerge?
I think you will see that. I think you will also see physicians really hesitating as to what they can do, what care they can give to a woman who's pregnant and having complications. I think that hesitation will also lead to more women dying.
But I want to dig into that a little bit, because many of these states that do have these trigger bans, and I was looking into some of the fine print, some of them do say that it would be allowed in the case of the mother's health being threatened or seriously, or her death being imminent. So how do you make that call as a physician? How do you make that call? When do you know that the woman's life is actually on the line?
Well, I think this is what's hard, is sometimes we see where things are headed.
Right.
And so we might start the medical care in the case of a woman who's having a miscarriage sooner. We know that she's going to have the miscarriage. Now you might have to wait until she's lost a lot of blood. You might have to wait until she's septic and in the ICU to really move forward with that procedure.
But already, America is one of those nations that has a high maternal mortality rate. We're already kind of sort of messing up this process of helping women give birth. So it sounds to me like you're saying it's going to be even riskier.
Yeah, getting pregnant in the U.S. is already risky. It's going to get riskier. Researchers have estimated that we'll probably see our maternal mortality rates increase by about 20% with this reversal of Roe v. Wade.
20%.
Yeah.
That's incredible. Well, Dr. Celine Gounder, we thank you so much.